Chances are either you or someone you know suffers from dizziness. Well, Dr. Joe is going to tell us how it can be treated. Dr. Joe, I hear you treat patients that have dizziness. First of all, what causes dizziness?
Well, you know, dizziness is one of the most common complaints that are seen by family practice doctors and even by chiropractors.
Okay.
There's a wide variety. Almost any medical condition can cause dizziness. The most common form of vertigo, which is a specific type of dizziness, the one where you feel like you're whirling around, is known as BPPV.
Okay.
And we do have a new device to help treat patients that have BPPV.
What is that device called? Is it the Vertigon?
Yes,
okay.
Correct. The Vertigon unit is actually a goggle.
Okay.
And the patient wears the goggle, but what it does is it allows the doctor to properly implement a technique, a very well documented technique in the scientific literature known as the Epley maneuver. And essentially what happens is in the bottom of your inner ear are little calcium crystals, and they're there for a reason. But in some people they get dislodged and they float back up into the system, and they actually stimulate cells that make half of your brain think you're moving, half of your brain thinks you're not moving, and it results in the whirling sort of vertigo. Dr. Epley recognized that by moving the patient's head through a series of postures, you can move those crystals back where they belong. And that's the procedure. And like I say, in some studies it's shown almost 90% effective as a virtually instant cure. I had a patient who had 2 months of continuous vertigo who got up from the table and hasn't had it since, and that's probably over a year now.
Wow. Do you have these goggles here?
Sure do.
I'd love to take a look at them.
Let's go.
Dr. Joe, let's see these Vertigon goggles.
Okay, well here's what the goggles look like. Just very simple, and they're going to be very becoming on you.
Oh, quite the fashion statement, huh?
And so what you do is just go ahead and put this on so your right eye is
okay.
lined up with that. Oh, I was right, see?
Perfect.
Ready for
lovely.
Huh?
Yes.
And as you can see through this eye. Now with the other eye, you should see a little ball sort of floating there. Use this little thing here and go ahead and focus it. So you can slide this back and forth. That's it, just so it's in focus for you.
There we go.
All right. And then basically we use this to diagnose first.
Okay.
So the first thing we would do with the patient is see whether it was their left ear or right ear that had BPPV. And the way we would do that is very, very simple. And all we're going to do is have you look over your right shoulder as far as you can. Okay. That's it. And then I'm going to lean you back. And as you lean back, just go ahead and let your head hang over the edge of the table. You ready? Okay. So we'll just lean you right back. That's it. We just hold you here for 30 seconds or so. And we'll just bring you right up.
Perfect.
So what we do then is remove that diagnosis sphere and we put this treatment sphere in, and then you'll put these on again and focus that.
Perfect. Dr. Joe, this just seems so easy. And
it's very simple, and again, one of the beauties is it doesn't matter what medications you're on, it doesn't matter what diseases you have, this is not dangerous in any way. And what we do at this point is put you through what's known as the Epley maneuver.
Okay.
And that's a series of postures that we put you through to move those crystals back to where they belong.
And that just takes a matter of a few minutes?
Just takes a matter of a few minutes,
Perfect.
Exactly.
Thanks, Dr. Joe.
Sure.
If you want to find out more about this treatment or other types of therapies, you can get a hold of Dr. Joe at ferezyclinic.com or give him a call.